Okay, so this patient had a left posterior hip replacement. So up here they'll have the weight bearing status. This person's weight bearing is tolerated on the left lower extremity. Their precautions are the posterior hip precautions, and what we'll do is list those out over here for the patient to see as well. So no bending over 90 degrees, no twisting, and no crossing the legs. Over here you have the levels, or the mobility. So you have the bed mobility, transfers and gait, and then the type of device they use for gait. So bed mobility, their minimal assistance, transfers, their minimal assistance, and then gait, their contact guard assistance for 20 feet using a rolling walker.
Okay, and down here you'll find how much assistance the patient requires for ADLs. This includes bathing, dressing, and toileting. So for this patient, they're set up for upper body ADLs and min assist using the reacher and the sock aid for lower body ADLs. And then under special instructions, you'll also see that we list how much assistance they need or what they need to go into the bathroom. For this specific patient, they require the staff assistance and the rolling walker to get to the bathroom.
So we have our patient in supine. So we're going to get her to the edge of the bed. Right now she has the rolled up sheet between her legs. You can have that, a pillow. Sometimes they'll come from the hospital with that purple foam wedge, which is used to go between their legs, because when they're sleeping it helps them from crossing their legs, which obviously is a hip precaution. So her left leg is the surgical leg. So we're going to get to the edge of the bed. So you always want to explain what you're going to do before you do it with a patient. So patient, I'm going to get this down here. Okay. We're going to come and sit at the edge of the bed. Now remember your precautions. You don't want to bend over 90 degrees. You don't want to cross this leg over this one. And you also don't want to twist. So if it's more than minimal assistance, you may have to help them not only with their leg, but with their trunk. But minimal assistance a lot of times is helping them move their leg to the edge of the bed. So if there were any more assistance needed, like moderate assistance, you might have to help them with their trunk. Have them scooch to the edge. Yep, keep leaning back, making sure she's not going over that 90 degrees. She's doing a good job because her knee is below the level of her waist, and that's kind of a good indicator if you're breaking your hip precautions. You always want the knees to be below the waist level.
Okay, so as we said, for this patient, she requires min assist for lower body dressing. So in her room, she should have the reacher and the sock aid, which were listed on the board. If these are in her room, then she should be able to use them herself, maybe with some cueing. That looks okay? Mm-hmm. Now, when she's doing this, you want to make sure that they're not bending forward. We're still looking to maintain those precautions. No bending at the hips, no twisting. So next are the shorts. You always want to remind the patient to put their surgical leg in first. And while she's doing this, some other things that you might find in the room are the long-handled shoehorn, the leg lifter, the long-handled sponge, and the long-handled dressing stick. All right, so we made it this far. Now this particular patient needs min assist because she needs help with her shoes. So I'm gonna help her put her shoes on. Easier said than done. All right, there you go. So when putting on shorts, doing any kind of lower body dressing, you want to make sure that they're maintaining their precautions. So just make sure that they're not bending or twisting during those tasks. Okay, so before standing, you want to make sure that you put your gait belt on. You want to keep it nice and tight around the patient's waist. And it will loosen up when they stand, so make sure it's tight. And then you want to make sure the walker's in front of them. Okay, so now that the walker is safely in front of the patient, she can stand. When she's standing, you want to make sure that her hands are on the bed to push up, and that she is not breaking those hip precautions. So make sure that the leg is kicked out when standing. All right, you can pull those up. Good. Let me tighten this up a little bit for you. All right, so now that we're ready and dressed for the day, we'll come on over to the chair. And when the patient's walking, you to make sure that the toe is always pointed out of the surgical leg. That way you know that the patient is not twisting. All right, so when sitting, you reach back for the chair, kick the leg out, and sit down safely.